What is polio in children? What are the causes of polio in children? How do we prevent it from attacking our little ones when it surfaces? How to treat and manage it? You are welcome to our Healthy Lifestyle channel. Kindly fasten your seatbelt as we dive into the teaching for today. Introduction to polio in children. Poliomyelitis, commonly called polio, is a highly infectious disease caused by the polio virus. It primarily affects young children under the age of 5. Polio is a serious public health concern because it can lead to permanent paralysis, disability, and even death in severe cases. Though eradicated in many parts of the world, polio still poses a risk, particularly in regions with low vaccination coverage. Understanding the causes, prevention, treatment, and management of polio is essential in protecting children.
Causation and transmission. Polio is caused by the poliovirus, which is part of the enterovirus genus. It spreads primarily via the fecal-oral route, meaning that the virus is excreted in the stool of an infected person and can be ingested by another person through contaminated food, water, or hands. Less commonly, it can spread through respiratory droplets. Poor sanitation, lack of clean water, and inadequate hygiene practices significantly increase the risk of transmission in children, especially in overcrowded or under-resourced areas.
How polio affects the body. Once ingested, the poliovirus multiplies in the intestines and can enter the bloodstream. In some cases, it crosses into the central nervous system and attacks motor neurons in the spinal cord, leading to paralysis. Polio has 3 forms: abortive polio, mild symptoms like fever, sore throat, and malaise. Non-paralytic polio includes symptoms such as neck stiffness and back pain without paralysis. Paralytic polio, the most severe form where children may develop muscle weakness or full paralysis, typically in the legs.
Risk factors in children. Children are especially vulnerable to polio due to their developing immune systems and frequent hand-to-mouth behavior. Risk factors include lack of immunization, living in unsanitary or overcrowded conditions, poor access to clean drinking water, malnutrition, which weakens immune response. Young children in endemic regions or conflict zones are particularly at risk.
If you are finding values in this video, kindly like and subscribe. Also hit the bell icon to be notified each time I come online.
Prevention, vaccination. The most effective way to prevent polio is through vaccination. There are 2 types of polio vaccines: oral polio vaccine, now OPV, a live weakened virus given by mouth. It's easy to administer and provides community herd immunity. Inactivated polio vaccine, IPV, an injected form that contains a killed virus. It is safer for immunocompromised individuals. Routine immunization schedules typically include multiple doses starting at birth or 2 months, with boosters over time. Mass immunization campaigns such as those led by the WHO and UNICEF aim to cover every child, especially in high-risk areas.
Signs and symptoms of polio in children. Most children infected with the polio virus do not show symptoms. However, in symptomatic cases, early signs include fever, fatigue, headache, vomiting, stiff neck and back, limb pain, or weakness. In paralytic polio, these symptoms can rapidly progress to muscle paralysis, which is often asymmetrical and may become permanent if nerve damage is severe.
Diagnosis is typically made through clinical examination, focusing on muscle weakness or paralysis, stool samples where the virus can be detected, throat swabs, and cerebrospinal fluid (CSF) test in severe cases. Early detection is crucial to begin management promptly and to initiate public health responses to contain spread.
Treatment of polio. There is no cure for polio once infection occurs. Treatment is supportive and aimed at relieving symptoms, preventing complications, and improving function. This may include pain relief and fever control, rest and hydration, mechanical ventilation in cases of respiratory muscle involvement, physical therapy to maintain mobility and prevent deformities. Early intervention with rehabilitation services can improve long-term outcomes.
Long-term management and complications. Children with paralytic polio may suffer from permanent muscle weakness, limb deformities, or growth abnormalities. Some may experience post-polio syndrome decades later, characterized by fatigue and muscle weakness. Long-term care includes orthopedic support, braces, surgeries, regular physical therapy. Assistive devices like crutches or wheelchairs, psychosocial support, and inclusive education are also vital in helping affected children lead full lives.
Global efforts, particularly through the Global Polio Eradication Initiative, GPEI, have dramatically reduced polio cases. However, maintaining high vaccination coverage is essential to prevent resurgence. For parents and caregivers, the key advice includes: ensure your child receives all scheduled polio vaccines. Practice good hygiene, hand washing, using clean toilets, and drinking safe water. Participate in vaccination campaigns, even if your child is already vaccinated. Support public health initiatives in your community.
Summary and public advice. Polio is a dangerous but preventable disease, especially threatening to children. While it spreads through poor sanitation and contaminated environments, vaccination remains the most powerful tool to eliminate it. Parents must be vigilant with immunization schedules, and communities must work together to maintain clean environments and support healthcare access. Remember, a polio-free world is possible, but only with consistent prevention and public awareness. Advice for the public: don't skip vaccinations. Polio can come back if we are not careful. Encourage others to vaccinate their children. Report any suspected cases of muscle weakness in children to health authorities. Keep your home and surroundings clean to prevent the spread of infection.
Please like and subscribe. Thanks for watching.